Life sciences are basically any sort of company that really is helping in healthcare. So that could be pharmaceuticals, biotech, medical devices, suppliers, etc. We think that there are multiple reasons why people should be looking at global life sciences right now. First and foremost is innovation. Second, demographics. We're in a world right now where there are more people over the age of 65 than there are under 5. Globalization, so you're seeing rising incomes in these emerging market countries that are really supportive of additional spending within healthcare. And then finally, the more defensive characteristics of healthcare, especially in this long duration bull market that we've been in. When we do see a recession, we know that healthcare tends to hold up better in these more recessionary environments. So, we're seeing incredible innovation within the healthcare space. In 2018, we saw a record number of drugs being approved by the FDA at 59. And so far into 2019, we're on track to have 40 new drugs approved this year. There are 3 reasons why we think why now for healthcare. 1, innovation. We continue to see this strong innovation coming out of healthcare, which leads to greater growth for the space. 2, valuations. When you take a look at healthcare valuations, not only relative to its own historical prices, but also relative to the broader markets, they still look incredibly attractive. And 3, for the defensive characteristics. So when we talk about being fearful of a recessionary environment, when we do see a recession, healthcare tends to hold up well in that type of market. But with this great opportunity does come some element of risk. Right now we're seeing a lot of volatility in the sector, really being driven by the political rhetoric in the US with our upcoming presidential election. On the Global Life Sciences team, we live by this rule of 90-90, which means 90% of drugs that enter human clinical trials don't make it all the way through to FDA approval. And of that 10% that do make it through to FDA approval, the street tends to be wrong 90% of the time about what that commercial launch will do, whether they're too aggressive or too conservative in their estimates. So we want to know both the science and the business when analyzing healthcare companies. We think we have the expertise to know both the science and the business. Andy Acker has been the lead portfolio manager for the last 12 years. He is supported by a team of deep resources of analysts dedicated to the healthcare sector, which has led to strong outperformance over his tenure.